Hello, Team 7. This was an excellent presentation comparing Singapore healthcare system and an in-depth view and how the system actually works and functions. So my question for you this week is, how does, in these systems where you have national healthcare systems or government payer systems, how do these systems not go overutilized by individuals? How do you safeguard that patients don't overutilize the system? That's one question I have regarding this. Whereas folks that are otherwise healthy may underutilize or even overutilize the system, what does that mean for burden to that model? Where in the US, it's not typically overutilized because it's expensive. I used the AI to evaluate the US and the Singapore system, and I used several prompts that I'll list in words in my response. One of the challenges that I see in the U.S. would be the stigma associated with a national healthcare system. As I mentioned in class the other day, I guess my one big challenge I think the U.S. would have, or I have identified, would be that people would look at this as a socialized system, and they would not necessarily like that in this quote-unquote free enterprise or capitalistic society here in the U.S., where healthcare would be seen as a right, not a privilege, which I feel like it is now. That would be a challenge to integrate into our system, and I think that socially would have to be overcome to be integrated. Assuming that was integrated, how would that impact my current and future work? Well, I am actually a physician, so if it were implemented, it would certainly cut my salary, as I would be regulated more by the government. Certainly that would impact probably my choice of workflow of patient care that I would see. It might impact the surgical cases. It might impact volume seen each week. And I might be more mandated to see more patients rather than have a balanced career that I currently have, where I do research through the National Institutes of Health. What's not clear to me as well is what the research piece is like in Singapore. That's the second question I have, is how is that funded, and how do physicians provide not only care to patients, but also engage in meaningful biomedical research. So these two would be the biggest things that I think would impact my career going forward, but I think certainly would benefit, because in my mind, I would see that more patients would have access to care, better preventative medicine, and in the long run, you wouldn't need to see as many specialists as you would take care of preventable disease up front through better access. Again, great job on your presentation.